This is a role play developed as part of the course curriculum for Manage TB, an online course for doctors. The participants have enacted the roles given to them. The case discussed does not refer to any existing patient but has been developed as part of the course curriculum. The investigations, such as X-rays and lab reports, used in this case scenario belongs to patients treated at National Institute for Research in Tuberculosis, Chennai. Their identity have been anonymized.
Good morning, ma'am.
Good morning, Dr. Kritika.
Ma'am, can I discuss a case with you if you are free?
Yeah, sure.
Ma'am, a 55-year-old male who is a building construction laborer by occupation came with persistent cough and loss of weight and appetite for more than 6 months. And he is a diabetic on oral hypoglycemics for 5 years. He is a smoker and has history of alcohol consumption for the past 35 years.
Okay.
His sputum smear shows positive for acid-fast bacilli. And his line probe assay shows that the organism is resistant to both isoniazid and rifampicin. And so we asked for a line probe assay of the second line drugs, but it shows that it's sensitive to fluoroquinolones and aminoglycosides. His chest X-ray shows bilateral parenchymal disease, ma'am.
Yeah, so what is your diagnosis for this patient?
Ma'am, I think he's a case of MDR-TB.
Right, so he's a case of pulmonary multi-drug resistant tuberculosis. Do you have any other information on this patient?
Ma'am, I had asked about any previous anti-TB treatment. He had taken 3 months of ATT under RNTCP about a year ago. Then he discontinued his treatment since he felt better and also he had to relocate for his job. I also have looked into the available prescriptions and investigations. It shows that he has not been treated with fluoroquinolones and aminoglycosides.
Okay.
His FBS is 230 milligrams per day, and he is a smoker who consumes about a pack of BD per day. And I had done a physical and general and systemic examination. It shows that he has no pallor or clubbing or icterus, and he has bilateral crepitations on both the lungs and auscultation. Ma'am. Otherwise, his CVS is normal.
Okay, so you have done a thorough clinical examination of the patient. Would you do any laboratory investigation on this patient before you initiate him on treatment?
Ma'am, I would ask for a complete blood count with platelets. His blood sugar levels has to be monitored, and then I would ask for a TSH, and then urine routine, and then I would ask for liver and renal function tests, and then I would go for ELISA for HIV.
Very good. We would also like to do an audiometry on this patient because the treatment regimen would consist of an aminoglycoside.
Yes, ma'am.
We'll also ask for an ECG.
Yes, ma'am.
As we're thinking of adding on a fluoroquinolone. Also a mental examination or evaluation of his mental status before we put him on treatment. Now, assuming all the results come back as normal, so how would you plan to treat this patient?
Ma'am, since the patient is sensitive to both fluoroquinolones and aminoglycosides, this patient will have a treatment for a shorter duration of 9 to 11 months with 4 months of intensive phase consisting of kanamycin, moxifloxacin high dose isoniazid, and pyrazinamide, ethionamide, and ethambutol, and with continuation phase of 5 months consisting of high dose moxifloxacin, clofazimine, pyrazinamide, and ethambutol.
Very good. Yeah, so this patient would be an ideal candidate for a shorter course of MDR-TB regimen. As you know, the other regimen, which is of 24 months duration, has got the biggest drawback is the long duration of treatment for this patient. So before you initiate him on treatment, would you give some other advice or anything else that you would want to talk to the patient about?
Ma'am, since this patient has to be treated for a longer duration of 9 to 11 months, I would counsel him prior to the treatment initiation. I would personally tell him about the nature of this disease and the cause of this disease, because that is the prior treatment default.
Correct.
And then I would tell him about the side effects of the MDR-TB drugs and ask him to report immediately if he develops any one of them.
Right.
I will also tell him about the adherence to the treatment is necessary, and I will counsel his family members regarding the adherence to the treatment and also screen them for presence of TB.
Good. We would also like to counsel him about alcohol and smoking.
Yes.
So abstinence from smoking was advisable. Also talk to him about his habit with the alcohol. His blood sugar has to be under control. So the counseling should also include advice about diabetic management. Now that you have started this patient on a shorter course MDR regimen, how do you plan to follow up this patient?
Ma'am, his sputum smear has to be looked out for acid fast bacilli on monthly basis, and then during the intensive phase and during the continuation phase it has to be done on a quarterly basis, and then liver function test and renal function test have to be done periodically. Chest x-ray has to be done at the end of intensive phase and also at the end of continuation phase. Ma'am.
Very good. So periodic monitoring of the patient is very required. And during every visit, you also ask him about the presence or absence of adverse events to these drugs. So do you also consider any other modality of treatment in this patient?
Ma'am, I think surgical resection will do, ma'am.
Okay, so you're considering surgery in this patient. For this patient, surgery may not be a good option because the disease is in both sides of the lung. It's spread bilaterally. Surgery is a good option when your disease is restricted to a single lung, unilateral disease. Now, what if this patient in his investigation has shown resistance to fluoroquinolone and to kanamycin?
Ma'am, I think this patient will become an XDR-TB patient.
Okay, and so do you know the treatment for XDR-TB case? Okay, XDR-TB treatment is for a longer duration. You can make a regimen with the new drug, or in the absence of new drugs, you can make a regimen without the new drugs. So regimen with the new drugs will be for a period of 24 months, 6 to 9 months of intensive phase followed by 18 months of continuation phase. The intensive phase consists of capreomycin, ethionamide, cycloserine, linezolid, clofazimine, ethambutol and pyrazinamide. To be followed 18 months of continuation phase with ethionamide, cycloserine, linezolid, clofazimine and ethambutol. In the absence of newer drugs, regimen can also be made similarly for a period of 24 months. Intensive phase of 6 months consisting of caprio, high dose moxi, ethionamide, cycloserine, linezolid, clofazimine, ethambutol and pyrazinamide. That would be followed by 18 months of high dose moxi, ethionamide, cycloserine, linezolid, clofazimine and ethambutol. The dosing of these drugs depends upon the body weight of the patient. The guidelines gives you a weight band, and based on the weight band, the drugs can be used. For bedaquiline, the dosage is for a period of 6 months. The first 2 weeks, 400 milligrams to be given daily along with the optimized background regimen. For the remaining 3 to 24 weeks, it's 200 milligram 3 times a week along with the optimized background regimen. At the end of 6 months, bedaquiline would be stopped and the rest of the drugs would be continued for a period of 24 months. Now, can you very briefly summarize the treatment or management of an MDR or XDR-TB patients?
Yes, ma'am. The treatment for MDR-TB with shorter regimen is for 9 to 11 months duration. The treatment for XDR-TB is for 24 months duration, and the patient has to be evaluated for bedaquiline containing regimen. Dosage of the drugs has to be appropriate according to the body weight. Counseling of the patient is important prior to anti-TB treatment initiation. Pre-treatment clinical assessment and laboratory evaluations are important. Adherence to treatment has to be ensured. Clinical and laboratory monitoring has to be done during treatment. Those with unilateral resectable disease are ideal to benefit from surgery. The patient's family has to be screened for TB and have to be involved in the overall management plan.